Hey! Welcome to the Cancer Sisters podcast. I'm Nicole.
And I'm Amanda.
This is episode 13.
Lucky 13.
Lucky.
She's air quoting.
I know. It doesn't.
It's so lucky.
It's so lucky. It's so easy to fall in love.
A Linda Ronstadt classic.
It's so easy to fall in love. It's so easy.
It's so easy.
Yeah. Wow.
Somebody stumbled onto this podcast and said, "What the hell?"
And somebody was like, wow.
Literally, what is that?
Done.
We're done.
Well, we last posted to our social media. We said not ready to talk, and now we're ready to talk. So it's kind of on you.
Right.
I have a chest CT this month. Next week, Wednesday, I think, at 7 o'clock in the morning, which, I mean, why? But anyway, it's at 7.
Yikes. Well, what happened? Usually you have to,
Well, I don't have to fast because I don't have to have the dye.
Oh, okay.
Which is good, because if I had to have the dye, I'd have to take a steroid and a lot of Benadryl. And I'd have to fast. So I can just get up and go in whatever shape I'm in, have a quick CT, go back home and relax. And then at the end of the month, post 1 year anniversary of my lung surgery, I will have my next Flex Sig. Not that one has to do with the other, but...
Right. But do you follow up with the surgeon?
The chest CT is, I will follow up with the oncologist.
Okay.
And then the Flex Sig is my colorectal surgeon. And, I think when we last casted, I said I broke up with my radiation oncologist. I know we'll never see him again, so just down to the 2.
Right.
Plus,
and then do you know that after this one, does it get pushed out further?
No, I think I'm still on a 6-month kind of schedule. I don't know for how long, but...
Yeah. Okay.
But these appointments are the first 6-month window. So I don't anticipate I would change right away, but maybe, who knows? TBD.
Okay. Good.
All right, so
Good to know.
That was easy.
I knew you had something.
Yeah.
In June. Okay.
That was the easy one.
Well, gosh, it seems like it's been more than a week, but I had my CT of the chest last week.
And yours was because it was like one step with your new surgeons. They wanted one more chest CT.
Yeah. My last one had been at the end of January, literally. So, and this one was May 30th. So, almost exactly 4 months. Yeah. So, I guess it was, a little past 3 months, which is what I've been on for the schedule. But, and strangely, I got my chart results
an hour later.
That never happens, but it's the first time I went to the White Pond location, and they just seem not busy, which is great. And I felt like a radiologist was just sitting right there, ready to go. So, also not great was what the radiologist saw.
Right.
So, I don't know, if I'll deliver this differently because of the way I've been thinking about it, but I talked to the oncologist the very next day, and he said, one of the things he said is some growth is to be expected because I've been off chemo coming up on 11 months. Mm-hmm. But what's been resonating with me lately is that I didn't even make it a year without some growth.
Right. So there's growth back in your lymph nodes in and around your right lung. And
right in the middle, so in the middle of both lungs.
the hilar lymph nodes, which you spoke about
Mm-hmm.
a long time ago. And there's such growth in the hilar lymph nodes that it is pressing on your esophagus.
Not my esophagus, the bronchial tube.
Okay.
So it's something, the new portion of it, and I can read it, but I don't even know how to say it. It looks like media, meaning, middle, but then it's tunnel, like.
Yeah, it's
like
protruding onto.
Do I say mediastinal? But the portion of that is new because it took over a new place in there that it wasn't before, so that it is pressing on the bronchial tube. And I've had a cough like for the last month, a dry cough that just seemed kind of weird, and that's what's causing it.
Mm-hmm.
So
you had a nagging feeling, but
somewhere way back in the back of my head.
Yeah, but you weren't consciously thinking, okay, I can't wait to see what the CT says because it's going to give me news. You were more thinking, like check off the scan.
Yeah, literally just check it off the list. I got to do this, I got to do that, blah, blah, blah.
Yeah.
So, and then the one that's the node that was left over that had been very small, like under a centimeter in my lower right lobe, grew significantly.
Yeah, significant growth. And so, back to
over
what
that
your oncologist said,
yeah,
it's not to be unexpected. And he didn't really say there was a bright side to it, but that, he was at least pleased that you did get 10 or 11 months off. And all of that was, so you were able to have your foot repaired, and that was success. We thought for quite a while that you had a successful surgery in the fistula repair, so ideally that time off would have allowed you those repairs.
Mm-hmm.
Well, so 50-50.
Yeah, I'm still having, I can acknowledge all that, and still having a hard time seeing the upside to this because my last 10 or 11 months, even without chemo, have been pretty unpleasant. Mm-hmm. And yeah, I'm back to work and everything. But in the meantime, the last course of treatment I had is what has caused the avascular necrosis, so now I'm at a point where it's very hard to walk. And the fistula is not fixed.
Yeah, and the one-legged knee scooter, that probably didn't help either.
No, like pick a reason and assign a percentage. I mean, it could be
right.
Walking at an imbalance with that boot on for a long time.
Right.
So
I'll take radiation for 200, please.
Right.
I'll take menopause for 300.
Radiation for 500.
I'll take chemotherapy for 400.
And tell her what she's won.
The daily double. A whole lot of bullshit.
Yeah, one of the nurses in my appointments yesterday was like, what's going on with your hip? And I told her, and she's like, oh, well, how can, are they going to fix that with a hip replacement? I said, well, it's third in line.
Yeah.
So
let me tell you the good news about the hip replacement, which I had heard more than one time, but I recently spoke to a friend who had both a shoulder repair for the rotator cuff and the joint.
Jeez.
Yeah. And a hip replacement. And he said that the shoulder was just so much worse. He went home same day with the hip replacement. He said in 2 weeks it felt like nothing was wrong.
Wow.
So
I look forward to that time in the far distant future.
Yeah. That's a very long, rainbow, where you can't quite see the end of it. Yeah. Right. There's a little pot of gold at the end of it.
It's a good visual. Yeah.
You're welcome.
So
you talk to your oncologist, and the other piece is because you need surgery.
Yeah, I mean, when I got the news, before I talked to him, my first thought was, oh man, this means no surgery, and I'm going right back to chemo. Because chemo was effective.
And you'd admit there was a little bit of comfort in chemo because you knew it. You knew what to expect.
Right.
And you were like, okay, I can visualize this and I know what it means. Not that was comfortable because you had a lot of, probably panicky thoughts about what it, going back to chemotherapy would be like.
Yeah.
So your oncologist said chemotherapy is not an option.
Yeah, which sat on me like a bowling ball to the gut. Because he said, oh, you're between a rock and a hard place. And all I could think was, what do you mean?
Yeah. I mean, it didn't take him long to tell you
right
what it meant. It meant immunotherapy.
Which...
immunotherapy is your option.
Yeah, immunology, and I don't know what it means. I've been just basically not Googling it because what I know about it, I have sort of like 2 negative things that I know about it from other people, and I don't want to make assumptions. You're looking at me, but...
Well, yeah, what negative things do you know about?
Well, somebody that the last thing they did was switch to an immunology trial and died the next week.
That person was dying anyway.
So am I.
We all are.
Yeah, we all are. And this is the negative part, that this is why I try to keep myself away from people, but the truth of the matter is my life expectancy just got shortened again. Nobody knows. Like, tomorrow could be someone's last day. None of us know. I acknowledge that. But, am I, an 80-year-old just joined my swim team, and it's awesome. This couple and his wife came to watch him swim, and they're awesome. And I'm like, I don't even think I'm going to make it that far. If I can't make it 10 months without treatment. I mean, that's
fair.
Yeah.
I was just trying not to connect that to immunology.
No, and that's what I was saying was that, and then another thing I was told by someone that had done it, had taken one of the medications, and there are several, and there's different trials and everything. Like, I don't know what they're going to use, and I'm a different person, yes. But if I sit down and start Googling it before I talk, like, about the real details of this, I would probably not do it.
Right. And I don't think there's any use in that, because what your oncologist told you is what he knows about the trials for 2 medicines. And what he told us, there was fantastic results, and 2 people were even completely cured from those trials. So we know what your oncologist told you, and you have to wait, and you are showing great restraint in not looking it up. You have to wait. I mean, we're just days away from you talking to your new oncologist at the Cleveland Clinic.
Right. Which, I love my current doctor, but because I'm in main campus to find a solution for the fistula, and they have resources there that they don't have in our other hospital systems. They have more resources, and they basically house some of the trials.
Right. So greater access to the immunology. There are already doctors there using it.
Right. So yeah, that appointment's coming up. So I'll have a lot of questions.
Yeah.
That doctor.
There's a lot to know. There's a lot to learn still. So you were just up at the clinic for a whole lot of pre-surgical testing, which I don't quite understand, because you're not really having surgery. You're having a look-see.
Yeah. But I guess, because it's under anesthesia, they just label it surgery. And most of the people that I came across, didn't know, and they were like, good luck with your surgery and all the things when I was, and I I only like sort of corrected one person, but I was like, it's just an exam under anesthesia.
Mm-hmm.
But, you know, part of getting established in that system, they did their own blood draws too. I like sat in a room and she took 3 vials of blood and then wrapped up my arm, and then 2 minutes later someone else came in and unwrapped my arm and found the vein again.
That's so weird.
And took another, yeah. I don't understand why they did that, but
Maybe
that
was
was
just a mistake.
No. She told me. I go, why can't you just keep the needle? And then she hooks up what she needs for her sample.
Right. Just cap that off for a second.
Didn't have a answer for that. It was weird, but everyone was, you know, very nice. And so
You had an EKG.
I had an EKG, and then hung out on the second floor where the cafe and the Starbucks was, and had a snack, and saw Wayne Dawson. You know, and lots and lots and lots of medical people taking their breaks. Then I had kind of like it was pre-surgery, like they went over what, you can't eat after 12, clear liquids, you know, and I get to do 2 enemas.
One at night and one in the morning.
Yeah. I was like, why would I have to do that when I have an ileostomy?
Right.
And she went and asked for me. She, went and asked someone else. And they did, in fact, want me to still do that. So it's a little disturbing.
Yeah.
But so I had that appointment, and then I had I was going to be like an hour and a half early to the other appointment. It was up on the 10th floor. So just went in there and talked to a very nice lady, and she said, if you come back in a half hour, I'll check you in again, and then you could probably get in early. But she just sort of checked me in again, and I got in early.
And you did get in early, and you found this to be the most interesting of the day.
Yeah, which I had no idea. I just had an appointment with a doctor. There was no description.
Mm-hmm.
So I think it sort of could...
On purpose?
I don't know. I think it could have been, but it could have also, I wonder how many times that she gets a poor reaction about someone that comes into her office. But it's behavioral health. Mm-hmm. And I thought of Heather because she's a PhD.
Mm-hmm. So a doctor, but not like every other doctor in the...
Yeah.
Well, I imagine there's a lot of PhDs in the clinic. Because...
For sure.
Yeah.
Yeah.
Doctor.
What was really interesting is she had spent, I don't know, I think she said the first 15 of her career in pain management, and then she moved to this side of behavioral, which when she explained everything that she was doing, and I will do my best to explain it, but then she has a website with all these things on it, so I'm going to share that because I haven't looked at any of these videos yet, but I'm going to try it. But she was explaining the science behind the message that goes from your pain to your brain and says, hey, you're in pain. Mm-hmm. But the message that you send from your brain in anticipation of pain back to your body, that is turning up the volume on said pain. So it's knowing how to calm down your brain from thinking these things and doing these things, because they will cause more pain. They will delay your healing. Mm-hmm. And the one fact that I thought was really interesting, and she said the more relaxed that you are before you go under anesthesia, the less anesthesia you need. And also the science behind continuing kind of these behavioral techniques mm-hmm. as you're healing in the first 2-3 days after surgery shortens the amount of time it takes your body to heal.
Yeah, that is really fascinating.
They did she was telling me about some studies they did on rats years ago, and then they did these pain studies, and they eventually did it on humans, which basically was, we're going to flash a red light at you, and then we're going to shock your hand.
Oh.
And then in subsequent, they would like hook up to the brain like an MRI, and that the brain reacted the same and perceived the pain the same when there was no shock, but just a red light.
Oh, wow.
Yeah. So really kind of fascinating. And I mean, not everybody likes the science behind that, but I think it was, that was super cool. So she wrote, that's what this is. Cause
quite a diagram.
A stick figure, but
I think we're going to have to share that one on the old gram and TikTok.
Yes. And then one of the other things she pointed out, because I'm sort of going out of order, but she was talking about how much the gut has to do with emotion, and I think it was 94% of your emotions are controlled by your gut. And she said, like, think about it. Think about, I had a gut feeling. Oh, I feel it in my gut. I had butterflies in my stomach.
Yeah.
She said, we say all these things because we know that our emotions are coming from
but you can physically feel it there.
Yeah. Yeah. So
do you talk to that doctor at all about, how that changes having the ostomy?
No, but I did tell her about the cramping and the pain and stuff and the things that I've been doing with my food, but that I can recognize that stress is a big part of what is contributing to it. At first when I looked it up and I was like looking up colitis and things that I haven't been named, but that might be what I'm experiencing. And
stress was a common denominator.
Yeah. So the fact that she was talking about this, I was like, wow, that really makes a lot of sense.
Did she give you anything practical, like immediately to use?
Yeah, so she gave me her website, and her name is Judith Sheeman, Scheman. Told her I was...
She's She-Man?
Sheeman. I almost said, did people do this to you? Like, people were like, a man, duh.
Yeah.
Growing up. I almost said it to her. I was like, oh. But no, she's so lovely. And I told her, I said, do you mind because she has a couple recordings of podcasts that had been posted to the Cleveland Clinic's Instagram. She, it is on YouTube. She has all these links of these different techniques. And she said it was actually a patient that said, this is a few years ago, but this is something I do to calm myself down. And so there's a technique, and it involves, it activates the anti-stress hormones, so we don't have to name them all, but it has to do, and you start like in the crook of your thumb, and I haven't even looked at the video yet, but like how it has something you do with your fingers, just as one of those. And she said, like, that's one of the things you can do, like
reflexology?
As they're wheeling you into surgery. Yeah, so there's videos, and she said, okay, so then there's the post-op schedule for relaxation. So, and this I imagine you can apply this in other places like your life, but this is what affects recovery. So she said, when you wake up, you want to walk for like 10 to 15 minutes, like be active, like just in your home.
In recovery.
Okay. In your home or in the hospital. Like your goal is 10 to 15 minutes, and then spend 2 hours on your distraction. She was like, whether that's a Netflix binge or
reading,
working, music, conversation, and then she said, then you move again and you just repeat this. And so, but in the relaxation part, you're using these different procedures. A lot of people do this before they go to bed at night, and it helps them sleep.
Okay.
And you do these like 3 to 4 times a day. So let me see.
Is she okay with you sharing her website?
Yeah, she absolutely said, yeah. When she created it, the hospital asked her if it was just for patients or for everybody. And she said, no, like everybody should have access to it. And there was a sentence here I wanted to read. Well, I could share like all these bullet points, but I will share. I'll have it bookmarked on my phone, so we'll share it on Instagram. But you could also go to like Cleveland Clinic Behavioral Health and Dr. Shaman and then find her information. But she said, what's interesting is that the same brain chemicals responsible for depression and anxiety are also responsible for our perception of pain. Our pain makes our mood worse, and our mood makes our pain worse.
Yeah. Wow.
So I thought, like, this is super interesting. You kind of know it. You understand that when you think about things in a worse way, like when you're having gut issues, like, your view of the world is more cloudy. And when you feel good, it doesn't matter if it's raining out, you just feel better.
Right.
Like you have a better perception. So this isn't like the most brand new information, but like the way it was presented and how they use it for pain management and healing, I think is super cool. So,
is her website, like if you were to look her up at Cleveland Clinic Behavioral Health, you'd find it, or
yeah,
it's hosted somewhere separately?
No, it's there. It's but I just can't look at it right now since we're podcasting on my phone. So I will post it.
Okay.
So that's how I ended my day.
That's probably by design, I would think. Give you something to think about on your drive.
And what's cool is that, like you can, as a patient there, you can see her anytime. Or, request an appointment, request a phone appointment, just work on those techniques, that kind of stuff. She thought I had like a good handle on those kind of things. She asked me about what I do for relaxation. Kind of right now it's music, my red light.
Lay on your floor with that neck stretcher.
With the neck stretcher. Yes.
All right.
So.
Wow. That is an interesting start. We'll have to talk more about it.
It's a whole lot, yeah.
Well,
I told her I wanted to, share a resource and all her videos and the podcasts, and she said everything's like short and manageable.
Excellent. We like that.
So you're not going in to study. You're going in for the,
the relief.
minute and a half video that shows you how to do this.
Good.
So, yeah, so it has taken us, a week, or I can just say it has taken me this last week to go through a process where I felt like talking. And it's hard to want to let the news out because I don't want to have a lot of conversations about how I'm feeling or
right.
all that because I don't know yet. It's just I have a lot of sadness and a lot of anger.
Well, you and I even sat in a lot of silence when, last week when we first found out.
Yeah.
Because, like, there wasn't anything more to say. I mean, the what the hell or there's only so many times you can say it.
Yeah. Really, yeah. And it was, normally we just, if we're together, we talk about anything, and the stupid Instagram thing and that we laughed about before we started recording.
Yeah.
But I really, and you too, like it's just sat there sort of like a
lead balloon.
Giant lead balloon. So.
Not that I've ever been near a lead balloon, but somehow Somehow you can imagine it. It's like you can smell grass and still know what it tastes like without having to taste it.
Yeah.
Yeah.
It was a good analogy.
Yeah. I mean, we just had to kind of sit with it, and you've had a lot of busy, fun things going on at work, and we just had to delay when we could talk about it. So here we are.
And
Lucky
that's
13.
my form of distraction. And with every conversation I have had, everyone says, "And how's your sister?" So I don't know if that's triggering a little bit for you, but I have just said she's doing great.
It is a little triggering because you and I have sort of an awful pattern.
I go and then you go?
Yeah.
Yeah.
Yeah. And it's like not, somehow, it's not rational, but somehow it's rational. And you know this as well as I do, that when you have cancer or have had cancer, you kind of always think about it.
Mm-hmm.
And I've sort of been, not, not physically, but if I've sort of been tiptoeing into the spring and into the summer, like, is it really a diagnosis-free spring? Is it going to be a diagnosis-free summer?
I certainly hope so.
Yeah, so it's a little triggering. It's,
Well,
if
we're following our pattern, you're just fine because I'm not.
Wow. I don't know if that was exactly true either. But I felt pretty good, and I was, pretty strong last spring, and so the lung cancer was a pretty big surprise.
Right. I sat at the light at Miller and Ridgewood and watched a woman just puff away.
Oh, I scowled at somebody today.
Did you?
Holding one of those, the sign, the slow or the stop is your
yes.
drive. Yeah, just with just the old cancer stick hanging out of their mouth, and I scowled, and I'm sure they didn't see me or understand, but I was like, what the hell? I want to open the window and be like, that causes lung cancer, right?
Because I'm sure that's what she wanted.
Because that's what helps. Well, that wasn't...
That'll change behavior.
Right. Not to be super judgy, but I was so judgy, actually, when I was going by, because I...
That's why I said it.
Because
I had my judgy moment.
Oh, I was
yesterday.
So judgy, because I drove on by, and I was like, you know what? It's probably not the cigarette that's going to kill that person. Oh, promise, we're not mean. I promise.
But I think it's all part of... I do believe that those feelings are all part of processing everything.
Right. Like the last time I was at Blossom.
Right. Processing.
Well, to be continued. I think it was important that we got the news out, and we're going to have some interesting things to post on the gram.
We will. We'll post the resources and, some updates, because there's a lot that I'm going to be learning over the next week. And, so until then, we'll say our goodbye.
Goodbye.
Addio.
Addio.